Hello, everyone. My name is Dr. Jacobs. I'm a doctor of physical therapy, and I'm the inventor of advanced soft tissue release, ASTR specialty. I'm also a cancer survivor, and I used to suffer from chronic migraines, headaches, pain, and fatigue before I invented ASTR specialty.
All right, so tell me what's going on with your back.
Basically cracking all the time. It's constantly sore and inflamed. And it probably cracks around like 150 times a day, mainly when I'm standing on my feet and taking really big deep breaths, or whenever I roll my shoulders or try to do anything like that.
When you roll it back? Okay, so can you tell me, give me a history, like when that started, how long it's been going on?
It's been going on for about 6 months now. And it started when I slouched a lot growing up, and then when I started to try to fix my posture, I don't know if I'm maybe overcorrecting and trying too hard to fix it, but that's when it started.
6 months ago, you said? Okay, so what type of treatments you had so far before coming here?
No major treatments. I just tried to do some acupuncture work and chiropractic work to try to help loosen it up.
So can you tell me how you feel now? Your pain level, like at worst and...
At worst, it's about 6 or 7. And usually after a long day, I just have to go sit at home on my back all day.
And how much pain do you feel now?
Right now, I'm about like a 3.
3. So you have a constant 3 out of 10 pain. What kind of pain and where do you feel the pain?
From my middle back to my lower neck.
Okay.
And it's constantly just inflamed and really like achy.
Achy feeling?
Weak,
Okay. So if we want to aggravate your symptoms now, we'll have you just roll your shoulder back, and you said like taking deep breath is affected too?
Yeah.
Okay, so let's do that. I want you to aggravate it actually.
That just makes my spine crack a lot.
That's a sound.
All up in my shoulders,
Okay, and you did not have that sound before the 6 months? Okay.
No.
What about deep breath? Do you feel you get full deep breath, or you feel like you're not able to expand your lung as supposed to?
I don't like to take deep breaths because it aggravates it so much more. So I try to avoid it. So
Do you feel pain in the front?
No pain in the front.
No pain in the front. Okay. Is that burning from cupping?
It's not burning. It just like sort of suctions up. I think it's more to see where the injured areas. Friday.
Friday. So it was darker than this?
Yeah.
Wow. Okay.
Just to help show where the injury is at.
So you had cupping, you had acupuncture, you had chiropractic. What else did you have?
The chiropractic work was just to adjust my neck, though.
Adjust your neck. Okay.
Nothing else on my back because she doesn't want to touch it.
Oh, wow. Yeah, you really have a lot of scar tissue here. You feel those knots here?
Okay. I try to rub them out as much as I can.
Yeah, it's hard to break it with the hand, so
Yeah.
I have tools here to work on it. Okay. Look up nice and tall. So is your pain mostly on this side or
both sides?
Both sides. Okay.
Like when all this rolling right here. Just all in there.
No, that's too much. Man, you're really tight here.
Yeah.
Make sure this is not painful.
Feels good.
So I'm trying to release the tightness. And I heard your when you roll your shoulder back, it was loud crack.
That's
Is
really
that
painful.
normal?
That's normal, yeah.
Really?
Anytime I roll my shoulders, it just feels like all my joints are just grinding together.
So you feel no space in between?
No, I feel no space.
Do you know why this happened?
I have no idea.
Okay.
I have struggled with like joint pain like that, but I have no idea why.
Okay. So our muscle should act like a rubber band. When you contract and relax, it does this. When we have a scar tissue in the muscle, it's like you have a knot in a rubber band. So when your muscle contract, it does not stretch much.
Okay.
So when that happens, that does not allow a space between your joint, and things start to crack because there is the joint, the muscle is like limiting the joint range of motion. And you feel the pressure on your chest from the back, not the front.
On my chest?
Yeah, like when you breathe.
I don't feel too much pressure on my chest.
You don't, okay.
Maybe a little bit, but nothing that's like
It's
I
all
worry
from
about.
the
Yeah.
back. Yeah, okay. You feel this one here?
Yeah.
Yeah. And
Feels
you can,
very
is that the grinding you're talking about?
Yeah.
And you see my hand here? It's like rolling over the knot here.
Uh-huh.
It's very easy to see here.
Yeah, all in there as well, that grinding.
So you get a lot of scar tissue. That grinding is actually scar tissue.
Okay.
So you probably overdid it with the posture training.
Just overcorrected it and tried too much?
No. Okay, so how we get scar tissue? First is like with overtraining.
Uh-huh.
Think about I will just give you an example of external paper cut. When you have external paper cut, the first stage is inflammation.
Uh-huh.
Okay. The second stage is called the proliferation. That's when the body starts to build the scar tissue.
Mm-hmm.
So if our body does not build the scar tissue, it's open wound susceptible for infection.
Okay.
Okay. So scar tissue is very essential for our survival. Perfect scenario, our body go to the third and last stage of the healing, which called maturation, and the body gets rid of the scar tissue by itself. The same process happened internally, but with overtraining, or you overdid it with correcting your posture,
Uh-huh.
you cause micro tear in the muscle inside.
Okay.
So your body built the scar tissue, but your body did not break the excess of the scar tissue. So
Gotcha.
it's in the way. And when you move like this, you hear that grinding, or that's a lot of scar tissue in the middle.
I also was a golfer throughout high school,
Uh-huh.
so I was constantly twisting and torquing my back.
Okay.
And I think that's sort of when my backswing started. It's not when it was unbearable.
Okay.
Because I stopped golfing these past few months because I just can't do it.
Oh, okay.
But that could be another reason why.
So yeah, that's you. So you build the scar tissue. You probably built it a long time ago, and then
Yeah.
you add to it the posture training. So you build excessive scar tissue. It didn't feel cold. That I'm not gonna do the area that you had the cupping and the discolorization. Just, you feel all this bump here.
Yeah.
So this is not me, okay?
That area doesn't hurt, so if you do want to work on it, you can.
Well,
I asked her. I told her I was gonna do physical therapy, and she says, "Yeah, it doesn't matter."
well, here's the thing. My concern about when discolorization like this, that's mean inflammation.
Yeah.
So if too much inflammation happened, that's
Uh-huh.
gonna build another scar tissue from the new
Okay.
inflammation. You know, and unfortunately, I saw some patient that had first degree burn from cupping. You can
Really?
see the burn. I'm like, how that beneficial? If you start burning, you're causing
Yeah.
inflammation. Your body has to go to proliferation stage, which actually cause more scar tissue. So I'm not sure how beneficial is that. So if you're gonna get anything like that, make sure no burning.
Okay.
This side is not as bad actually. Is it worse in here?
It's about exactly the same.
Really?
Yeah.
I see it here. I can see the muscle is pronounced back, just sticking out in the back here. Relax, relax. Okay, let's move it and tell me how that feels. Any difference?
Yeah. Feels like it's freed up a little bit.
But
I
where do you
feel
feel
the-
the tightness?
Right down here in the grinding.
Right in here, the area that I
Yeah,
did not
this is where
work
my
on.
back is like cracking.
Okay, alright. I can go down here. Okay. Just do not want it to use it on the discolored area. Oops. Wow. Oh, sorry. I'm glad I did not get in your face. This is the cameraman's fault, okay? Oops. Okay, you can get that. It's funny, actually. You see lotion everywhere, don't step on it, okay? That's why when I'm working anywhere, they will have those like orange cones. Stay away. So you don't fall. Don't fall. Is that too much here?
No.
Okay. You hear that grinding?
Yeah.
That's a scar tissue. And here, you hear it?
Yeah.
Scar tissue here.
That's just about where my back cracks.
Yeah. Of course, that's gonna compress on your joint in here, all
Mhm.
this area. And I think you can hear it. Can you?
Yeah.
Can you hear that?
Yeah.
It's loud. Yeah. Man, your muscle talks now.
I know. I should have been here 6 months ago.
It's not too late. Okay. Make sure this is not painful. Okay.
Mm-hmm.
Okay. Let's move it again, and I'll try to clean my mess. How's that?
Feels good, better right on my spine.
Okay.
Definitely.
Do you still feel tightness and the cracking, or it's gone?
Just a little bit right in there, but
Where?
not as much.
Where?
Like probably right in here.
Okay. Relax.
And then just the grinding all in my shoulders right here.
Okay, the grinding sound,
Uh-huh.
it's gonna take us a couple of treatments,
Yeah.
okay? Because you have a lot of scar tissue.
Uh-huh.
My concern is the pain, okay?
Yeah.
And you're exactly right. You feel that?
Yeah.
That's
It's
right
all
on
over
the
the
scar
grinding
tissue.
is.
And here you said?
Yeah.
Yeah. Okay, here.
Mm-hmm.
Okay, because that's a very thick scar tissue. You're gonna
Yeah.
take us a couple of treatments to work on it to get rid of it. Okay. So try to go again. Let's turn around.
Turn around like this.
No, facing me. You can have a seat. You still feel the grinding? Not the grinding, the pain.
Not as much. No.
You know?
Definitely not as
How much from 0 to 10 now?
Probably like a 1 or 2.
Where do you feel it?
Just in my shoulders mainly.
In that shoulder?
In both of them.
Both of them? Okay. Let me do one more thing.
Yeah. But the tension in my back seems to go away a lot.
And how is the breathing now? Do you feel you're breathing back to normal or not yet?
Feels better, definitely.
Okay, I gotta get some towels. Alright, so you sit in here. Sorry.
Yeah. I'd say right in here.
The whole thing?
Uh-huh.
Okay.
It almost
This
feels.
one?
Yeah.
Okay. I'm giving you injection, okay?
Okay.
Not really. Sorry, is it too much? Sorry. Make sure it's not painful, okay? Make sure you let me know, okay? There's
Okay.
fine line between breaking the scar tissue and causing the scar tissue, okay?
Okay.
I cannot see your face,
Yeah.
but I see it in the
It's definitely painful.
computer. Make sure you tell me, okay? We don't want to
I
get...
just don't know how painful it's supposed to be.
No, it's not supposed.
Oh, then yeah, that was painful.
Sorry.
It almost feels like where it's grinding is like underneath
The
my
scapula?
shoulder. Yeah, underneath my scapula.
Man, I got it here.
Yeah.
This is the one you're talking about?
Yeah, right in there.
Okay. Alright. I'll do this one. I will actually have you like put your arms like this.
Like this.
Yep.
Just open it up.
Yeah. Right in here.
Yeah.
Yeah, I did not get the underneath the
Uh-huh.
shoulder in the other position. And you feel it in the same way in the other side?
Yeah.
Man, how did you get inside me here? That's
I
probably
don't
from
know.
golfing.
I
Actually.
think it is.
It's golfing, yeah. That's a thick scar tissue under the scapula.
Yeah.
Is that too much?
No, it doesn't hurt. I can just feel
But
it
you can
grinding
feel it.
out,
It's a
yeah.
really very thick one here.
I've had this problem for
Let's do
longer
same
than the
thing
back.
On the other side.
My
had
shoulder. I've had this shoulder problem for
Mhm.
longer than my back.
How many years you had this shoulder issue?
probably like 2 or 3 years where it's just grinding. It feels like my joints are just grinding together.
Okay, well, I'm gonna dig to this more next time.
Okay.
Tell me how you feel now. Try it again. You still feel it or it's gone? The pain, not the grinding. We still have more work on this consultation.
I feel some of the grinding still lower, like scapula area.
What pain?
No, not too much pain, and then just a lot of the grinding in here. There's a lot.
So you're gonna continue feeling the grinding until we get rid of all the scar tissue. How much pain do you feel from 0 to 10?
It's about a 1.
1, you feel it in that area?
I just feel the tension. It's not that it necessarily hurts too much.
So where do you feel it?
Just in here.
Okay. Here and there. Okay, squeeze your shoulder plate. Squeeze it. And relax. Squeeze it. And relax. How about now? How's that?
Yeah, not so much underneath the scapula, it's just up here.
Up here?
I don't know if you can feel it, but
Shrug your shoulders. Man, you have a lot of deep scar tissue. Shrug it up. Yeah, I can hear the grinding actually. Up and hold it. Up and hold it. You really have a deep scar tissue.
Yeah. It's like now it's just mainly I feel the grinding right there and that's
okay.
how it shines.
As long as you don't feel pain, that's fine, okay? But the grinding, because the amount of scar tissue you have, you're gonna continue feeling it until we break it. Relax. We totally break it. Okay, how about the pain now from 0 to 10?
Okay. Minuscule.
Okay. So what do you think about ASTR treatment? You just you had
pretty instant, yeah.
Yeah. You feel the difference?
Yeah, definitely.
All right. Awesome. Thank you so much.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.